Hi everyone, welcome back to my channel. If you are new here, my name is Shreya and I share content around nursing, NCLEX preparation, and nursing careers in Canada. Today, I wanted to talk about something I get asked quite often, which is what is actually looks like to work in long-term care. As I have spent my majority of nursing careers in long-term care versus acute care. So my journey as a nurse, and I'm going to talk about what actually looks like in long-term care. A lot of people message me saying they have never worked in long-term care before, so they are considering, but they don't know what to expect or what to know. So I thought I would share my personal experience and give you some realistic picture of what LTC nursing is really like. So let's start with first, what is long-term care? Long-term care homes are a place where individuals live when they are no longer able to live independently. This could be due to aging, chronic illness, physical limitations, or conditions like dementia. Unlike the hospital where the patient comes in for a short-term treatment and then they get discharged, but a resident in long-term care often stays there for a long time. For many, it becomes their permanent home. So, as nurses, while you work as a long-term care nurse, you're not just focusing on treating medical condition, but you are also supporting their quality of life, comfort, dignity, and independence every single day. Talking about my first impression of long-term care nursing, so when I started working, I honestly thought it would be mostly the medications and basic care. But yes, the medications are also a part of the role, but I quickly realized that the job is much more than that. Very early on, I learned that the assessment skills are extremely important. You are constantly monitoring all the residents for small changes, things like subtle confusion, change in appetite, mild lethargy, or slight behavioral shift that could indicate infection, dehydration, decline in health. All these conditions that you have to monitor very carefully. So it really teaches you to be observant and think critically all the time. What a typical day look like? When we talk about a shift, what look like, it's quite busy because you are caring for large number of resident versus in acute care you have like 5 or 6 patients, completing all the residents required assessment, administering medication and treatments, monitoring changes in condition, communicating with physician and nurse practitioner for if any change in condition or any new orders, working closely with PSW other team member, responding to unexpected changes or emergencies, documenting any incident, updating care plans, supporting family members, and answering their concerns as well. So one thing I quickly realized that long-term care nursing is very collaborative. You are never working independently or something that you are thinking about, but you are constantly communicating with full interdisciplinary team member. In regards to what I did not expect while I was just starting the long-term care role, but yes, that's the big thing that surprised me, that how much a relationship matters in long-term care, where in hospital you might care for someone for a few days, but in long-term care you see those residents every single day, every shift, and sometimes for months or years, and you really get to know them as people. You learn about their life stories, their families, their careers, and the things that they make them like the things that they make them who they are beyond their diagnosis. So you honestly get to know them as a whole person, not just caring for a condition, but you are caring for people with their lifetime experiences. So it's a most meaningful part of the long-term care job. Communication in long-term care is everything. So when we talk about this communication, it's the most important skill in long-term care nursing that you get every day, interacting with the different people, residents, families, physician, nurse practitioner, pharmacist, physiotherapist, other allied health professionals such as dietitians, PSWs on the unit, everybody, and especially family members, because they rely on nurses for updates and reassurances. Building the trust with them becomes just as important as providing clinical care. So strong communication really helps improve both resident outcome and overall environment. A little bit talk about caring for a resident with dementia. So that's the major part of the long-term care nursing, is caring residents living with dementia. This requires a lot of patience, empathy, flexibility, because residents may have difficulty expressing themselves, they may feel confused, or they may show some responsive behavior. So in those moments, person-centered care becomes so important, trying to understand the person behind their diagnosis rather than just the behavior. So I have learned that small things makes a huge difference, like calmly reassuring someone, listening without rushing, or respecting their preferences and routines. So those small actions can completely change experience in a day. Talking about challenges, of course, it's has some challenges too. So the common ones that I have experienced or I have seen so far is managing multiple residents at once, heavy documentation, staffing shortage, time management. It can be difficult emotionally sometimes when you are caring for end of life residents as well. So there are definitely days that you feel physically and emotionally exhausting, but at the same time these challenges will help you to grow. You become stronger in prioritization, clinical judgment, leadership, and communication. The reward, despite the challenges, there are many reasons why nurses choose long-term care and why many stays in. So the most rewarding part includes building the meaningful relationship with the resident, developing a strong clinical and leadership skills, seeing the impact of your care over time, working closely with a supportive team, and making a real difference in someone's daily life. So for me personally, that's the one of the most rewarding thing. That's those small moment, a simple conversation, or taking few extra minutes to sit and listen can completely change that someone's day. So, and they often remember those moments more than anything else. So let's talk a little bit about who might enjoy long-term care nursing. So from my experience, it would be good fit if you have a strong communication skill, if you are interested in working with geriatric or elderly population, enjoy building relationship with people, you value holistic and person-centered care, you like mix of like teamwork, collaborative care, and you want to build strong assessment and clinical judgment skill. It is a specialty where you really see the long-term impact of your care. Final thoughts on working in a long-term care has completely changed my view, how I view nursing. It's not just about the medication or treatment or a task, but it's about relationship, dignity, and supporting people living as fully as possible. It can be challenging, yes, but it is also incredibly meaningful. So if you are thinking about long-term care nursing, I would say go with an open mind. You might be surprised by how much you learn and how rewarding it can be. So yeah, that's all about long-term care nursing. Thank you so much for watching my video. I would love to hear from you. Have you ever worked in long-term care before, or is it something that you are considering? Please write down any thoughts or any suggestion, or if you have any question in the comment box. I will see you in my next video. Thank you.